This is Mon Health Live, your source for the latest news, numbers, and vaccine information related to COVID-19. It's what you need to know now to make informed decisions for you and your family. Here are your hosts, Mon Health System CEO David Goldberg, Mon Health Chief Nurse Executive Dr. Crystal Atkinson, and WAJR's Kyle Wiggs.
And good Saturday morning. Welcome to another edition of Mon Health Live. Thanks for joining us on this Saturday. And what we do on these programs is push the information out. We try to get the best and the latest information about this pandemic, about the number of cases, which, thank goodness, they're reduced in the last few weeks, and about the vaccine. We're going to talk a lot about the vaccine. David and Dr. Crystal are with us on this Saturday morning. Guys, thanks for coming on the show once again.
Thanks again for having us. Let's go Mountaineers.
Yes.
Good morning, Kyle.
Good morning. Thanks for coming in and doing the show once again. We have a special guest as well, Dr. Candi McCullough. She's OBGYN with the Mon Health System. And Dr. McCullough, thanks for joining us this morning.
Yeah, thanks for having me.
We'll start with you. I want to get the latest numbers and the latest information about the hospital and about the facilities with David and Dr. Atkinson. But tell us a little something about yourself, Dr. McCullough.
So I've been with Mon now for 5 years in August, really loving my time in Morgantown. Originally from Ritchie County, which is a couple hours from here, so I'm a West Virginia girl.
Mm-hmm. I know Ritchie County well, right? Straight out on Route 50.
Yes.
All right, very good. And your specialties?
OBGYN, general OBGYN. So we take care of pregnant women, but also women of all stages of life.
Mm-hmm. All right, very good. David and Dr. Atkinson, let's turn to you briefly for the latest information. David, the hospital, we've talked for many weeks now, the hospital staff is mostly vaccinated. The hospital is very safe. The hospital is doing most procedures right now. They're screening to get in. We just encourage people to get done what they need to get done at the hospital because it may be one of the safest places that exists.
I think you just did the whole radio show in about 30 seconds, Kyle. That's spot on. I mean, we're back to normal related to many of our procedures are back to being scheduled, whether it be orthopedic or elective MRI. We're doing well. Our offices continue to see patients either by telemedicine and or in person and are becoming busier and busier. From an overall COVID perspective, we continue to vaccinate new employees who join us, let alone work with the county in the vaccination center. So I'm going to continue to make my plug for people to go on to vaccinate.wv.gov to register. You will be contacted when you are eligible based on the criteria to be vaccinated. I say it every time I'm on the radio with you. I don't have 3 eyes, I don't have 3 heads, I don't have 3 arms, and I'm not microchipped. My wife will attest to that. She has no idea where I am. Please get vaccinated.
All right, so David's been vaccinated with both doses. Dr. Atkinson, you've been vaccinated with both doses, correct?
Correct.
All right. Dr. McCullough, what was your experience like with the vaccination?
I've received both of my vaccinations at this point. I had a little arm soreness with my first dose, a little headache with my second dose, but tolerated it very, very well.
Okay, so all 3 of you have been fully vaccinated, just like most of the employees at the Mon Health System and certainly at Mon General Hospital. So that's good news. And David, as we mentioned, the number of cases, the number of active cases, it's falling. Some of that has to do with the weather. It's warmer. It's easier to socially distance, but the number of cases are going down, and I think the vaccine has a lot to do with that as well.
I do think that has a lot to do with it. I think the social distancing, the wearing of masks, we just are celebrating, if that's even the right word. About a year ago, the first patient at Mon Health Medical Center came in a year ago this week. And what we've seen is a lot of learning, a lot of opportunity. I think the vaccinations have gone a long way, but people are washing their hands more. They're being a little more distanced, a little bit more responsible. That's definitely played into where our numbers are today. But as we all have heard the president say last week on his news conference, and Dr. Marsh and the governor, this is not the time to step back and not continue to follow the guidance.
Now, when this program airs on Saturday, this will have been in the past, but on March 18th, you mentioned March 18th, that was the first patient that came through the Mon Health Medical Center that was COVID-19 positive, and obviously it was a very difficult winter with illness, and unfortunately some people they succumbed to this disease. So back earlier this week, you had a moment of silence and just a moment to remember those who went through so much this winter.
It was. I've had personal situations. My brother, thankfully, is still alive, but he had COVID with his wife in New Jersey. One of my best friends lost both of his parents this past year. Both had underlying conditions, died within a week of each other in a hospital in Virginia. We all have all those stories, unfortunately, to share. But at the same time, we've come a long way in a year. We've learned a lot. The community has rallied around each other. We support our healthcare and frontline, first-line defenders and supporters. And here we are a year to talk about it. But again, I can't be more stressful about how lucky we are in North Central West Virginia to have the hospitals, the healthcare professionals, the governmental leadership to get us through this. And here we are a year later talking about it.
Mm-hmm. Dr. McCullough, you are one of the frontline workers, and you worked through this just like so many of your colleagues. What are your thoughts on a year passing since the first positive case? And obviously we're kind of seeing the light at the end of the tunnel now.
Absolutely. I feel like our darkest days are behind us. I'm feeling hopeful. But again, as David stressed before, not the time to certainly become lax at all, but there is definitely hope and light at the end of the tunnel.
Dr. Atkinson, your thoughts on 1 year getting through this?
I can't stress enough, as has previously been said, that there's so many things that we need to be cognizant of, and then making sure that we keep in the forefront, that we have the mitigation factors that we continue to have in place, so we don't continue to see the loss that we have seen over the past year. So we just really need to be vigilant, and we need to be mindful of all of those factors that are out there for us.
Okay, the number of vaccines are increasing, and again, that's one of the big reasons why the cases are down. David or Crystal, if you want to talk a little bit about how the facility at the mall with the old Sears location, how efficient that's been and how crucial that's been to getting people vaccinated.
So as we get more vaccines delivered to the community, the more we can put into the vaccination centers, not just here in Monongalia County, but in Preston, in Lewis County, and all the communities in between. Everyone's doing the same. We've been very lucky. Congressman McKinley just came last week as an example to tour it. Couldn't be more pleased. We see thousands a day. It is a seamless operation. If people register, yes, there were some glitches with all the different database systems that many have experienced, and we're sorry for that. But that being said, we're trying to manage different people based on their criteria. Right now, over age 50 and those with medical conditions that are cleared by their physician are recommended to be able to get the vaccine. We hope, and we are following very closely with the federal guidance and the governor's guidance, that we can open up more broadly. And as vaccines are available, we work down our list to make sure those who are 18 and above, 21 and above, 30 and above with comorbid conditions get access to the vaccine. But we definitely want to get a couple, the people that are older and more vulnerable first and work our way down. And we're seeing thousands of people seamlessly getting their vaccinations very timely.
All right, again, so it's still important to register, vaccine.wvu.gov, vaccine.wv.gov. So if you haven't registered, if you haven't had your first dose of the vaccine, please go to that site and get yourself registered. All right, we've got a break coming up in just a couple of minutes, but Dr. McCullough, speaking of the vaccine, is it safe for pregnant women and for nursing moms? What's your advice to people that fall into those categories that haven't been vaccinated yet?
It is absolutely safe. It is recommended by all of our societies like ACOG and the Society for Maternal Fetal Medicine. Initially, when it came out, it hadn't been studied in pregnant women, but we now have a group of 30,000 pregnant women, mostly healthcare workers, who received the vaccine, and those women have been tracked, and we have not seen any safety signal that would be concerning at this point.
So 30,000 pregnant women have been vaccinated up until this point, again, with no safety signal concerns. So it's safe for pregnant women. It's safe for nursing mothers. What about the antibodies? If a pregnant woman or a nursing mom is vaccinated, do those antibodies get passed along to the baby?
Yeah, we have some preliminary data that is out now that shows that antibodies are present in the breast milk. Those would be type IgA antibodies. And we also have a study out now that looked at cord blood of the infants at time of delivery. And pregnant women who were vaccinated during their pregnancies, they're finding antibodies in the baby's cord blood. So we think that this antibodies, if vaccinated during the pregnancy, are then also crossing in the blood to the baby.
Wow, that's great news. I mean, that's the best way to protect your infant or your baby in the womb, is to get vaccinated, and those antibodies are passed right along.
Correct.
All right, very good. That is tremendous news. And again, we just encourage everybody, and of course, pregnant women and nursing moms, it is safe. Again, 30,000 pregnant women have been vaccinated at this point, no safety signal concerns. So we encourage, if you're in that category, don't hesitate, get registered and get your vaccination. This is Mon Health Live for the Saturday morning. Thanks for joining us. We are with Dr. Crystal Atkinson, Chief Nursing Executive of Mon Health Systems, also David Goldberg, President, Chief Executive Officer of Mon Health Systems, and our special guest, Dr. Candi McCullough. We'll continue the conversation on WAJR after this. WAJR after this.
Tracking COVID-19 with the Mon Health experts. This is Mon Health Live. Here's Mon Health CEO David Goldberg and Chief Nurse Executive Dr. Crystal Atkinson.
Mon Health Live for this Saturday morning. Thanks for joining us on WAJR. Dr. Atkinson, David Goldberg with us. Our special guest is Dr. Candi McCullough, OBGYN with the Mon Health Systems. And David, really quick, I don't want to confuse people, certainly, but that website to get registered, it's vaccinate.wv.gov. I think I may have said vaccine during that first segment, but it's vaccinate.wv.gov to get registered.
Yeah, and if I may just remind our listeners, please, and we know we don't like the spam calls on our cell phone at all. I know I block them. But right now, you will get a phone call and or a message that may be a number you don't recognize. So we ask you for the next few months, as you're registered, please answer your phone, because it could be the health department trying to call to schedule you or notify you that you're eligible for your vaccine. So answer your phone. Mm-hmm. Thank you.
Yeah, and I can personally attest to that. I got my call last week for the first dose, and the area code that came up on my phone was 866, I believe. So initial reaction is, I'm not going to answer that. I don't know exactly who it is, but you're right. If you're on that list and you're expecting a call, you need to answer your phone.
Yeah, and I know it's difficult. We're priming and trying to train everybody. Don't answer spam calls. You're on the do not receive list. But right now, more than ever, answer that line. If it's still not the vaccine center, hang up on them. But until then, at least validate who it is before you don't answer.
Yeah, very good. Okay, Dr. McCullough, let's talk about this virus with pregnant women. First of all, are pregnant women more at risk to contract this virus if they haven't been vaccinated?
Yes, pregnant women are considered a high-risk population. Pregnant women can have more severe disease, meaning hospitalization or vent requiring, versus a woman the same age who is not pregnant. And we have data now also that those women who test positive for COVID in pregnancy have an increased risk of adverse outcomes in pregnancy. There's an increase in the risk of preeclampsia, preterm delivery, and a 23% increase in pregnancy loss rates.
Mm-hmm. All right, so it's the same for pregnant women, but it's more important probably for them to wear that mask and go through all the same protocols that we've been talking about for the last year. I know it's probably a little bit more difficult to breathe with that mask, but you have to do it, especially if you're pregnant.
Absolutely. Okay.
If you think you have contracted COVID-19 and you're pregnant or nursing, what should you do? What's your advice to someone who's pregnant or nursing that's showing symptoms?
Definitely call your doctor's office and let them know, and they will guide you from there. So majority of patients will have mild disease that you can manage at home with over-the-counter cold medicines, things like that. It is okay to continue to nurse the baby. You should wear a mask during feeding so that you're not breathing into the baby's face when the baby is very close to you. But it is beneficial to breastfeed and continue nursing because the woman's body will make those antibodies like we talked about earlier that will cross in the breast milk and help to protect the baby. There is a very low rate of infant infection, both vertical transmission across the placenta and nursing mothers. We've not seen a high rate of transmission to the infants.
Okay, so contact your doctor, obviously, if you're showing symptoms. When should you go to the hospital?
So if you have shortness of breath, that's difficult for pregnant women because a lot of pregnant women have shortness of breath at baseline. But if you're talking and you can't get a sentence out without having to stop and catch your breath, then that is concerning, and you definitely wouldn't want to go to the emergency room if you're having sudden shortness of breath. If people around you think that you're talking and you're not kind of making sense, those you feel weak or dizzy, like you're going to pass out, those are concerning signs.
Mm-hmm. We've done shows, we've done these Mon Health Live shows, a couple of them on the monoclonal antibody treatment. If you're pregnant or you're nursing and you're COVID-19 positive, are these monoclonal antibody treatments advised, and are they effective if you're in those two groups?
So they're recommended for people who are at risk of progression to severe disease. Fortunately, most pregnant women are going to have mild disease. They haven't specifically been studied in pregnant women, but again, if it's going to be they say not to withhold treatment from a pregnant woman just because she's pregnant if the treatment is deemed beneficial.
Okay. And basic gynecological care, have you seen women putting this off a little bit? And we talked about the safety of the hospital and, of course, all of the Mon Health clinics, but what's your advice to someone who has been reluctant to see a physician or to just get the basic care over the last year because of this pandemic?
Yeah, absolutely. We have seen women delaying care, especially for things like annual exams, routine pap smears, routine mammograms. We pretty much are back to normal operations at this point. We have very good infection control policies in the office, and we don't want to delay that care that could potentially detect an early cancer that is much more treatable in an early stage. Delayed care, it could be much later diagnosis and more difficult to treat. Mm-hmm. So we don't want to delay detection of those things. Okay, so don't put it off. It's safe to go into these places, and I know David and Crystal, you both feel very strongly about that as well.
Yeah, absolutely, Kyle. Just as we've shared before, there's no reason to delay. There's nothing that you can catch coming in. We really are looking and focusing on prevention. We're screening. We're making sure that we're taking all the necessary precautions for everybody that enters the building.
Okay. If you're looking to come into any of the emergency rooms across the Mon Health system, we haven't talked about this for a while, but you can go to the website and see the real-time wait times. David, there's good information there. If you're thinking about if you have to make an ER visit, you can know going in how long you're going to have to wait. Absolutely.
We pride ourselves at Mon Health System and all of our emergency rooms. You're immediately roomed. We do allow one consistent visitor with anyone coming to the ER. We want you to have your patient advocate with you so they could hear what you're hearing, be able to translate what you're hearing. But they will be screened to make sure that if they have COVID symptoms, they won't be allowed in. But that being said, it's important. Right now, I looked on the website. I'm looking right now. There's no wait. So you can look. It's live time at Mount Health Medical Center, at Stonewall Jackson Memorial Hospital, and Preston Memorial.
Okay. About a minute to go, and I want to ask both doctors this. If you don't have a primary care doctor, Dr. Atkinson, what's your advice to people that have put care off for a year?
Yeah, again, we need to make sure that everyone is seen. We have the ability to be able to see people on the weekends. We can also have people go directly to our website, monhealth.com/physicians. You have the ability to be able to find a primary care physician. They have openings available and willing to source that ability to be able to see anyone that needs care.
And Dr. McCullough, those who've put off the OBGYN visits, there's no need to. If you don't necessarily have a primary care physician, there's there are opportunities there.
Absolutely, and we welcome anyone back. Pretty much everyone is in the same boat. They haven't maybe been seen for a year. We don't care. We will welcome you with open arms. Come on in to be seen.
David, final 30 seconds are yours.
Yeah, and as Dr. Atkinson said, on the weekends, our Mon Health Wedgwood offices are open for walk-ins in evenings and weekends. Of course, if you're listening from Preston, we have urgent cares in Reedsville and others that are available. So please don't put off your health care. If you're not feeling well, contact a doctor. We'll take great care of you.
Very good. David Goldberg, President, Chief Executive Officer of the Mon Health System. Dr. Crystal Atkinson, Chief Nursing Executive of Mon Health System. And our special guest this morning has been Dr. Candi McCullough, OBGYN. Everyone, thanks. Great information once again, and we appreciate your time.
Thank you.
Thank you so much.
Thank you for having me.
All right, very good. Thanks for coming on. That is Mon Health Live for this Saturday morning, 104.5 FM, 1440 AM, WAJR.